Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the intercostal nerve. So first of all, we go to the definition of the intercostal nerve. Definition. Okay. The intercostal nerves are the anterior primary rami of. Okay. These are the anterior primary rami of T1 to T11 spinal nerves after the dorsal primary ramus is given off. Okay, so we got that. So here is the spinal nerve formed by the ventral root and the dorsal root. Okay, we should have a dorsal root ganglion here. Okay, so ventral root, dorsal root, then formation of spinal nerve here, and this spinal nerve has two divisions. This is the ventral primary ramus of spinal nerve. This is the intercostal nerve. Okay, and this is the dorsal primary ramus. This is the dorsal primary ramus of spinal nerve. Okay, so our intercostal nerve should begin from this point. Once the dorsal primary ramus is given off from the spinal nerve, then this is the anterior primary ramus or ventral primary ramus of the spinal nerve. This is the intercostal nerve. Okay, then we got the definition. Now we'll go the typical and atypical intercostal nerves. Typical and atypical intercostal nerves. The typical intercostal nerves are present inside the intercostal space. Atypical intercostal nerve, they are formed as usual, but they are also distributed outside the intercostal space. So we have the third, fourth, fifth, and sixth intercostal nerves are typical intercostal nerve. Atypical intercostal nerves are the first intercostal nerve, second intercostal nerve, then the seventh, eighth, ninth, 10th, and 11th intercostal nerves. Intercostal nerves, they are the atypical. Okay, why atypical? Because first and second intercostal nerve that also contribute in the innervation of the upper extremity. First intercostal nerve will contribute in the formation of the brachial plexus. Even sometimes second intercostal nerve may also contribute in the formation of brachial plexus in post-fixed type of brachial plexus. Okay, second intercostal nerve also give a branch called intercostobrachial nerve. There is a lateral cutaneous nerve of the second intercostal nerve. So it innervates the axilla, floor of the axilla, and upper part of the medial aspect, and also the posterior aspect, upper part of the skin of the axilla is covered by the second intercostal nerve. Okay. How about the seventh, 8th, 9th and 10th intercostal nerves. They are called thoraco-abdominal nerves. Thoraco-abdominal nerves. Okay, so 7th, 8th, 9th, 10th and 11th intercostal nerves are called thoraco-abdominal nerve because they innervate the thorax and abdomen. Anterior-abdominal muscle are getting innervation from the thoraco-abdominal nerves from the T7, 7, 8, 9, 10th and 11th intercostal nerve. Then we'll get a term called subcostal nerve. That is not an intercostal nerve. Subcostal nerve. Okay, subcostal nerve is the anterior primary rami of T12. Okay, so that is not in between the ribs, so it is not an intercostal nerve. Okay, and this nerve supplies the anterior abdominal wall, lower part of the anterior abdominal wall, the skin over the gluteal region, below the iliac crest, up to the greater trochanter of the femur. Okay, we got the classification of intercostal nerves. Okay, typical, atypical. This is not an intercostal nerve. This is subcostal nerve. It is below the 12th rib. Okay, so we got the classification of the intercostal nerves. Okay, so we'll go area of innervation of the intercostal nerve. Intercostal nerve innervates which part of our body? Certainly intercostal space. So area of distribution. Area of distribution. Both motor and sensory. It is a mixed nerve. Okay, so it innervates the skin and muscles of the thorax. Skin and muscles. Okay, it innervates the skin and muscles of the thorax. We have the intercostal muscles. Intercostalis externus, intercostalis intimus, intercostalis internus. Okay, so we have externus, internus, and innermost intercostalis is also called intercostalis intimi, innervated by the intercostal nerve. Intercostal nerve innervates the parietal pleura. It innervates the skin of the upper arm, especially the intercostal brachial nerve, also the lateral cutaneous branch of the T1, T2. The lateral cutaneous branch of T2 is also called intercostal brachial nerve. Muscles of the abdomen, including external oblique, internal oblique, transversus abdominis, plus rectus abdominis muscle. So area of distribution is much bigger because we have many nerves, so big area of distribution. We got the intercostal muscles, area of distribution. Okay, course. If you go to the course, okay, so this is the formation of intercostal nerve. Course. Each nerve passes below the neck of the rib of the same number and enters the costal groove. Okay, so it should go below the neck of the rib of the same number and enters the costal groove. Costal grooves are this depressed area on the rib. This is a rib. This is another rib. This part is called costal groove. This is the costal groove, and it contains neurovascular bundle. We have the vein, artery, nerve. So the intercostal nerve is the lowest component of the neurovascular bundle in the costal groove. Okay, so we can remember in this vein, artery, nerve in the costal groove. Nerve is the lower part of the costal groove. Even it may go further down. Okay, so this is the vein, intercostal vein, intercostal vein, intercostal artery, intercostal artery, and intercostal nerve. Intercostal nerve. They are arranged in the costal groove of the rib from above downward. Top structure is the intercostal vein. Then we have the intercostal artery. Then we have the intercostal nerve. You can remember by vein, V-A-N, vein. Okay. So this is the arrangement. Okay. So initially the intercostal nerve passes behind the intercostal vessels. Then it goes below in the costal groove area. Okay. It is in between two layers of muscle. There is the internal intercostal and the innermost intercostal. So the neurovascular bundle is between two layers of muscle. One is, this is the external intercostal, external intercostal. Okay, this is the internal intercostal, internal intercostal muscle, intercostal muscle. Okay, this is muscle. Okay, and this is the innermost intercostal muscle, innermost intercostal muscle, intercostal muscle, also called intercostalis intimi. Okay, so posterior part, nerve passes between the pleura and endothoracic fascia on the inside. Outside we have the intercostal membrane. Okay, so but in the greater part it is between the second layer and the middle layer. Even in the thoracoabdominal region, it is between the thoracoabdominal nerve passes between the transversus abdominis and internal oblique muscle, between the second layer and the third layer. Okay, so we got that. So this is the intercostal nerve. It goes there. It usually gives a collateral branch very close to the neck of the rib. Okay, it gives a collateral branch. Okay, that should go down. Okay, the collateral branch is there. Collateral branch. It should give a collateral branch. We got that. So we got the collateral branch, and it has other branches. The lateral cutaneous branch here. This is the lateral cutaneous branch. Lateral cutaneous branch. Cutaneous branch. Okay. Here it is the anterior cutaneous branch. Anterior is lateral cutaneous branch is here. This is the anterior cutaneous branch. Cutaneous branch, and look at that. The anterior cutaneous branch has again two divisions. One is the medial branch, another is the lateral branch. Lateral cutaneous branch has two divisions, posterior division and anterior division. And so we got that. So these are the branches. Okay. So near the sternum, what happened? The anterior cutaneous nerve, it should pass in front of the internal thoracic artery and the sternocostallis muscle. Okay. So we got the branches of the intercostal nerve. Okay. We got that. So we have to remember that the intercostal nerve is also connected to the sympathetic ganglion. This SG, that means that sympathetic ganglion. Sympathetic ganglion. Okay. So we got that. It is the sympathetic ganglion, and intercostal nerve is connected to the sympathetic ganglion by two Rami communicants. One is gray Rami communicans, that is proximal Rami communicans. Another one is the white Rami communicant, that is distal Rami communicans. Rami communicans. So we can call these are also branches. These are the branches from the intercostal nerve. So proximal one is the gray Rami communicans, distal one is the white Rami communicans. So these are for the sympathetic nerve innervation. From where sympathetic nerve is coming is from the lateral gray horn, then it follows the ventral root spinal nerve, and it goes through the white Rami communicans, and it goes to the sympathetic chain of ganglion. Then it has multiple distribution. Some fiber may synapse here, then go out through the gray Rami communicans. This is the gray Rami communicans. Some of the preganglionic fiber don't synapse at this level. It may go up, go down through the sympathetic chain of ganglion. Even some of them go through the splanchnic nerve, go to the pre-aortic ganglion like celiac ganglion. Okay, so this, which is going to be synapse here, they will again distribute along with the peripheral nerves. Some of them will distribute it to the peripheral nerve. So this sympathetic along with the motor sensory component of the intercostal nerve. Sympathetic is for vasoconstriction. They are pseudomotor. This sympathetic are vasoconstrictor. Pseudomotor. And pilomotor. Pilomotor, we have a muscle in the hair follicle that is also stimulated by the sympathetic innervation. Okay, so let us summarize again. We have formation of the spinal nerve in the intervertebral foramen. Then we have posterior primary ramus is coming out. Then at this point, anterior primary rami is called intercostal nerve. We have typical intercostal nerve. We have atypical intercostal nerve. We discussed that part. Most of the part of the intercostal nerve is between the second layer and third layer of muscle. Initial part, it is between the membrane, okay, on one side. So, and the pleura and endothoracic fascia inside, okay. It is the membrane, the intercostal membrane there, okay. We got that. Now, we have gone through that part. This is neurovascular bundle. Our relationship is vein, artery, nerve. Okay, this is the anterior cutaneous nerve. It will innervate the skin over the sternum and anterior chest wall. Lateral cutaneous nerve. It is coming out of the intercostal nerve at the level of the mid axillary line here, the mid axillary line. Okay, and it will innervate the lateral chest wall. There is free communication between the anterior branch of the lateral cutaneous nerve and the posterior branch of the anterior cutaneous nerve. Like that. We have also anastomosis between this and that. Okay. And we also discussed sympathetic chain of ganglion connected by white Rami communicans and the gray Rami communicans. Okay. Now we have gone through the intercostal nerves, and we have the atypical intercostal nerve that should supply the anterior abdominal wall. Okay, and typical intercostal nerve is located in the typical intercostal space like third, fourth, 5th and 6th intercostal space. Now we'll go to the clinical anatomy. Okay, clinical anatomy, we have many terminology, many problem. Okay, like that of, we may have pain, intercostal neuralgia, pain in the intercostal space, and to anesthetize the pain, usually we like to anesthetize more than one intercostal space because there is overlapping of the dermatome. Okay, so it may happen, this type of pain may happen due to spread of cancer cells there. Okay, then another term is called herpes zoster or shingles zoster. So it is just like the chickenpox virus that was hiding in our posterior nerve root and dorsal root ganglion. It may flare up as the age advances, low immunity, there will be blister formation along the dermatome, and it may affect any dermatome, but chest wall is an important point, is an important site of shingles or herpes zoster. Okay, we got that. Then we have to know few things also very much important clinically, that is the dermatomes. Okay, dermatomes are the specific area of the skin innervated by a particular segment of the spinal cord, like dermatome of the nipple, male nipple, female nipple, nipple of the child, nipple of the adult person, nipple of the obese person. Okay, so it doesn't matter, dermatome would not change. It is always T4. So T4 because it is innervated by the 4th intercostal nerve, T4 here. Okay, dermatome of the xiphoid process is the T6. Dermatome of the umbilicus is T10. Dermatome over the symphysis pubis is L1. Okay, you have to know the dermatome here, and also the cutaneous innervation of the first intercostal space. Okay, so that is from the C3 C4. You must remember that cutaneous innervation of first intercostal space is from the C3 C4, that is coming out of the cervical plexus, from cervical plexus. So first intercostal nerve has no cutaneous innervation to the first intercostal space. Okay, we got that. So that is important to us. Dermatome is very important to us. Okay, so and that's all about the intercostal nerve. If you like my video, please support my channel, please subscribe me. Have a nice day. Bye now.